Okay, so you're going to see a bunch of slides. This is second hire. It was paid for by McMaster Department of Family Medicine through a grant. Please bear with me. I am not a presenter. I am just a human being doing things. So I'm going to do my best. Laugh, cry, enjoy, complain later. You can call McMaster. This is like about land acknowledgements. I didn't know about doing one for here because I know they don't happen everywhere. My screen just went weird. So in Canada and other countries, we do land acknowledgements. I'm going to say it a little bit differently than what's on the slide. I am a stepmother of an Indigenous person, and I don't have a right to raise her. She has taught me so much, and the people that steward the land that I live on and play on and get the honor of being on, that, I'm just going to say it out loud, that colonizers maybe stole from them, have taught me so much and encouraged me to do this work. If that made sense. This is a slide about me. Biggest thing is I'm a person who, for majority of my life, and the only expertise I have is I did a lot of drugs. I got in a lot of trouble. I tried to do drugs and show up to things I couldn't. I love people that can. Drug use almost killed me numerous times in different ways. I'm just going to talk about involuntary treatment really quick because I know it happens in some places. I was sentenced to treatment 15 times in my life. I did not get well out of any of those times. Today, I live a good life based on things I learned then and based on the love of people who use drugs today. Full disclosure, I am not a doctor. On some of these slides, you're going to see a lot of statistics. I'm also not a stats person. No offense to researchers. Numbers aren't my thing, relationships are, so I'm going to do my best to explain this. If you do have questions, the email address of the physicians in this program is not on there, but I can get it for you if you want medical questions. Next slide. This is not changing. There we go. Endocarditis, heart infection. A lot of people need to get valves replaced, 6 weeks antibiotics. It is responsible for 5 to 10% of deaths for people who inject drugs. The problems we're trying to address, these things. So the biggest thing for me, alongside like heart infection and like healing the heart infection, is the bottom part of this slide. A lot of people use drugs in my community in Hamilton, Ontario. Unfortunately, the people we interact with and the people we met in the hospital are people that are mainly unhoused, that are not given opportunity for education, and are not given opportunity for social assistance. In Canada, in Ontario, and Hamilton, if you live on the street, you get $300 a month to exist on. Our shelter capacity in Hamilton is about 400 beds. We have about 2,000 people living unhoused. So low socioeconomic status leads to poor health outcomes. I'm sure everyone here knows that. Our intervention. I'm going really quick because I want to talk more about my role as a peer in this program, so please bear with me. I still have 12 minutes. So we connected people with infective endocarditis with peer support worker. I did a lot of that work. We had other peer support workers that worked for Canadian Mental Health Association who were great, but different people work with different populations, and I ended up seeing a lot of the people you'll see and hear about in this program. We also had a systems navigator that helped with taxes, tried to help with housing. There is no housing, so it's pretty much very sad meetings where people are like, I really want to get connected with housing supports, and the systems navigator had to be like, there are no housing supports, and then I drank coffee with them and talked about it. Peer work is awesome sometimes. Family physicians, we did primary care for people. A lot of the folks that we've seen with the Second Heart program didn't have primary care, didn't have access to primary care. Family medicine is very clinical in a lot of places. You have to go, you have to make appointments. You get charged $40 if you miss said appointment. So people just weren't engaged. Full disclosure, I went 5 years of my life with not seeing a doctor after like getting well according to like recovery standards because of trauma and pain caused by the healthcare system in my life. And because of doing this work with this program, I've been able to reconnect with healthcare in my own journey. Addiction medicine physician, if desired, people didn't have to make decisions about their substance use for them to be accepted in this program. They can continue, they could engage with addiction medicine, they didn't have to, they would still get all the same supports. For the following year, which included, you'll see in the slide, we gave gift cards, we gave money, we gave phones, we just hung out with people, and we didn't expect anything in return. Because meeting people where they're at while you expect them to go somewhere else is not meeting people where they're at. That's my opinion, not McMaster's. So remuneration, I just talked about. Participants received $250 over the year, done by surveys. It was cash payments. McMaster has now moved, if you ever do research with them, has now moved to gift cards. Yep. Gift cards are great. Unfortunately, as a person that used to like sell narcotics, I don't know if I'm allowed to say that from up here, I would buy gift cards at 50%. I would take cash dollar for dollar. So we try to give cash in like a lot of the work I do. People used to discourage us. They're like, you give people cash that use drugs. And I'm like, yes, the same as I give cash to people that don't use drugs, because people are people and we all deserve the same things. We also gave people a phone, and we paid for their phone bill for a year, just so they could connect with people. We also gave people many phones, because sometimes phones are a form of like commodity, a way to like have a house, have somewhere to live, and do what you need to do. Outcomes. 21 participants were referred to the study, 20 consented to enroll. One person is like, get the F away from me. I ended up still connecting with that person, but they didn't fully enroll in the study. Enrolling in studies for people that have done research involves putting your name on a piece of paper, and some people don't love doing that. 12 people were still active to follow-up at the end of 12 months. 35% were lost to follow-up. One participant died due to endocarditis. 50% female, mean age 35, 24 to 62. The person that passed away was under the age of 30. 70% of the participants were unhoused, 10% precariously housed, couch surfing, or transitional housing, which, if you understand transitional housing in Hamilton, I want to dare to say all of Ontario, it's still homelessness. You don't have rights as a tenant, you don't have a lot of things. 95% unemployed, 85% receiving social assistance. So there's many people that get denied Ontario Works that are living outside because they can't meet the requirements of all the things Ontario Works asks you to do to get social assistance in Ontario. You have to fill out many forms, give 3 months of bank statements, explain why you can't get bank statements, all of the things. And sometimes there's just too many barriers to allowing people money to eat. That's just my opinion. Again, I'm very opinionated about this stuff. Like I said earlier, only 50% had a primary care provider. 15% of that 50% had a visit in the year prior to their endocarditis. That's due no thing of their own. It's due to barriers in the healthcare system. I today still struggle to go to my doctor's appointment because I don't like clinic admins. Honestly, I phone and it's like make an appointment and then come a week later. I'm like, I just need to see a doctor now. 20% were on methadone or Suboxone, also Sublocade, and 35% had experienced an overdose in the 3 months prior to admission. 100% of participants were seen in hospital from the substance use service. 95% with opiate use disorder were prescribed OAT at discharge. So 20% were on before, 95% at discharge is pretty good numbers, I think. I'm not a stats person. But having 95% with a plan of care is pretty freaking amazing, I think. Patient outcomes, 2 reinfections occurred. If people know about endocarditis, people get reinfected quite often through injection drug use. 1 death due to endocarditis, 85% of people had 1 more ED visit, and 55 had a hospital admission. I'm just going to skip through this really quick because I only have like 5 minutes left. So read that really quick. I'm skipping the slide. All right, so qualitative themes. I'm just going to tell you 2 really quick stories that show both ends of this work. I have the honor and privilege, I think I said in my bio, of doing this work not because of anything I've done. I'm literally just a person that showed up to life one day in a different way than I showed up the rest of the time. I am humbled, honored, and forever grateful by the people that let me walk with them through this journey. People that use drugs, people who don't use drugs anymore for a variety of reasons, families who let me sit beside them as they lose someone. This stuff is heart work for me. People always wonder, I work like 6 jobs in Hamilton. They're like, why do you work so much? I'm like, it's heart work, it's soul feeding, and it's the only thing keeping me alive. These quotes were from some people, but the 2 stories I want to tell you really quick, because this timer says I have 5 minutes. One person, reluctant to engage, right? Just did not want to engage, moved from the hospital to this place called Transitional Beds Program at Good Shepherd in Hamilton. And the staff there, because they weren't doing the things that the staff wanted them to do, we're going to kick them out. And they're like, he's not getting out of bed. He just lays in bed all day. And I'm like, okay, sometimes this work is palliative. And I know that's hard to say, and I know it's hard to hear, but sometimes it is. But it doesn't always have to be if you engage with people. And you let people be people, and you meet them where they're at, and you spend time with them, and you sit with them. So I would go visit this person in the transitional beds thing every other day. And I would never ask him to get out of bed. I would never say, you need to eat. I would never say, you need to like do this, you need to do that. I'm like, what do you want to do today? And we would sit and we would talk and he would play guitar laying in this hospital bed, in this transitional beds thing. That person today is living back with his family, has a job, still using, but shows up to life in a way I never could. And I still connect with him, and it's been like 2.5 years. The person that passed away taught me more things than I think I've ever learned through any book, lecture, motivational video, or any of the above. And she taught me that by being present, by not apologizing for her own existence the way we try to make people do sometimes. And I think that's the biggest thing about peer-led models, peer work, grassroots organizations, and dare to say humanity, is we let people be people without apology, and we let them show up, and we love them in spite of what may look difficult or what may be hard. I've had a few conversations today about like peer models and why a lot of places, I don't know about anybody out there, but a lot of places in Hamilton, to hire a peer, the person has to be abstinent for a great amount of time. And I'm like, why not just like find ways to employ people actively using or that don't meet your definition of wellness instead of waiting for them to conform to what you think they need to be? Nobody has that answer. So if anybody does, please find me later. So more engagement. Lessons learned really quick. We have to do more. Multidisciplinary things work, peer work works, peer support and substance use care are the most utilized parts of the thing. These slides will be available online, I think. I signed a little sheet. Many bigger forces at play. People have competing priorities. If you're living in an encampment, you leave your encampment, the city's going to throw your stuff out. Having stuff is sometimes more important than seeing a doctor. Ongoing toxic drugs crisis. I don't call overdoses personally overdoses, I call them drug poisonings, because I can use the same amount of drugs as I did yesterday and die today because I don't know what the hell I'm putting in my body. Because we refuse to regulate. This is the biggest thing. We need upstream intervention to address social and structural determinants of health and meaningfully improve health outcomes for people who use drugs. And then it went through ethics. I don't think anything I said did, but that's fine. The end. Can I go?
No. We have 2 minutes for questions. So please, if you have something to ask, you can do it now or in the end of the session.
I would like Marcie to say that I was impressed and very happy when you said something very interesting, and it shows how it is in many places. You said that you were the one who believed and tried to pay in cash and not in cards, tokens, food stamps, etc. This is very important because it is a way of controlling the person and their money and making them not use drugs. And the fact only that you chose that spoke to me about a lot of things that you said later. And I wanted to say that it made me really happy.
What I do now, actually, like, 'cause I do studies with Master, and Revenue Canada also makes people give out gift cards. If anybody knows Revenue Canada, the wonderful government. I will now just give people the equivalent of cash. I'm just like, here's the cash, I'll keep the gift card, no one's gonna know. They might now, but like, whatever. Anybody else, or can I sit down?
Do we have any questions?
Is there a drug users place in Hamilton? So Keeping Six is like a group, an advocacy group. It actually started really quick. Anyone here that knows Toronto, Hamilton, Ontario, Urban Core does an amazing job. Unfortunately, they're peer workers who are active users, and they changed their policy to not hire people that actively use, so drug users were treated bad by the safe consumption site that they worked at. We started Keeping Six. We've been kicked out of 4 places. We're still going. It's a bunch of people that love people that use drugs, actively use drugs, used to use drugs, and a few doctors, and we just hang out. And we're connected to Toronto Harm Reduction somewhat, and on Put and Kaput a little bit. But we're trying to do more things. We hire drug users, so I'll get into it in a different slide or another presentation, but I manage the Safe Supply Clinic, and out of 120 patients, 12 of them are now paid employees. And we also do cash payments for encampment cleanups, outreach. We give about $2,000 in cash a week to people actively using or in the community.
Okay, thank you very much. We will have time for questions.